This is Ken Pyle, and we're at the 2012 Broadband Communities Summit with Nancy Green of Verizon. Nancy, you're going to be talking about senior housing and what can be done there in that vertical. Why don't you tell us a little bit about some of the things that you're going to be talking about on the panel you're on?
Well, it's a part of this segment, or that segment is a very fast-growing segment. By 2020, over 7.5 million seniors 85 or older will be in that segment. And that segment consists of lots of different sections, and that trend of growth is the same in all those segments, that trending of growth. So it's a huge segment. There's lots of technology growth in that area, and owners of those segments and those senior housings, we're going to be talking about a lot of those trends and what are the things that you can do to increase your revenues. So it's going to be an exciting panel discussion.
So what are some of the things that a senior housing owner can do in terms of adding value to technology to create better value for their customers?
I'm not going to give away all the secrets. You have to come. But so the increase in technology. So first and foremost, studies have shown that people actually want to be taken care of remotely, which is surprising. Believe it or not, even seniors. Some people think that seniors don't want to touch technology, and they do. So remote technology, so remotely monitoring their health. They want to be, video is a huge increase in being able to take care of patients remotely. So that increasing in access of care, so being able to take care of the patient remotely, being able to interconnect with their family and their friends and their grandkids, and being able to connect with their circle of friends and their circle of care is a big proponent of their care. So those kinds of things. Sorry.
So, no. I was just kind of wondering, what's driving it. It's kind of, you would think that seniors would kind of want that one-on-one touch, but it sounds like.
So it's interesting because they actually feel more cared for because their physician and their care group can check in with them more often, and it's actually less expensive for them because they don't have to leave their home. Right, because they're over their broadband, over their cable, directly with their computers. They're over their television. They can see their physician. They can see their nurse. They can see their care nurse directly. If they're being remotely monitored on while they're stepping on a scale or their blood pressure, if any of those monitoring devices send a signal that their weight is going up or down or their blood pressure is scaling the wrong way, their nurse or their physician can intervene very quickly. They can make a phone call, and what that does is intercede that they don't have to go to the emergency room or some event doesn't happen. And that's a huge cost savings in the healthcare system overall, but it's also a savings in their health, right? So there's not an event that triggers a costly event or a serious event in their health.
Well, and you touched upon something that I'm kind of curious how it plays into it, and that's the kids and other family members. How, by having this remote access, how does that impact?
Adult children are most of the time are not close. Like in my family, my mother lives in California, and my sister is the only one that lives close to her. My two brothers live further away than I do. So as remote adult children, I can now check on my mother's care through a portal, an electronic portal on the web, and see how she's doing. I can check on her through video. I can check on her weight, on how she's moving around in her home. All those things those are all technologies that are not intrusive at all to her. She knows that they're there, obviously, but I can actually see what's going on and be very part of, a big part of her care and know what's happening right, without, being intrusive.
Well, and I just wonder if there's an opportunity as well in the sense that you can give someone the technology, but if they don't know how to use it, it doesn't do a lot of good. So is there an opportunity there for the housing owners and so forth to kind of, help the seniors access it?
Yeah, okay, so there's two pieces of it. One is kind of a non-intrusive where it's in there and there's a revenue source to it. And then there's the interactive, which is what I think what you're mentioning, which is for education. So they can interact with it to learn about their health, learn about nutrition. They can actually access it for physical therapy. To do the physical therapy that they need to after a surgery or to increase their walking or increase it, specific
and you can make sure they're doing it.
Right, and they can actually do it over video with the physical therapist at the other end. Let's say it's very difficult for them to get to a physical therapy session. They can actually do it over video with the physical therapist at the other end so they can watch what's happening. So the technology is not so intrusive that it's difficult for them to do. is one way to do it. Education is another. They can watch videos for, let's say, a procedure that's coming up, or the one that they had. So how do I do to take care of, what do I need to do to take care of something after a procedure or something like that. So there's two ways, very inobtrusive monitoring type of things, and then something that they can work, that they can interact with.
And I was just thinking of the simple things like my mother-in-law, she has an iPad, but I don't know that she knows how to do the FaceTime. We taught her once, but she could use some help on the other end.
Well, interestingly enough, I think you and I have talked about this before. The first thing you actually want to have them do is to learn how to use it. Yeah. And one of the first things most people teach them how to do is to do solitaire, right? Because that actually teaches them how to use the device. Right. FaceTime is easy, but in most cases in healthcare, we try and tell people that if you're doing that with a doctor, it's not compliant. So that there's things that owners of buildings want to do that are HIPAA compliant. You have to work with some of the healthcare rules that are involved, and those are things that we can help owners do and work with that are HIPAA compliant. Those are things that you want to make sure that are involved in the services that you do.
Oh, yeah, exactly. Privacy is of most importance, right?
It is. Although, when you're talking with your family, it's not, it doesn't matter. But when you're talking about when you're doing it with a physician or something like that, it is.
But being able to actually see your mother or mother-in-law, and it kind of gives you a hint of what their condition is,
right? So if you're a son doing that, can you imagine what it is with a nurse or a physician? If there's a wound or if there's something, just seeing, when you're talking about mental health or physical therapy, seeing the movement or increase or decrease in the ability than the last time you saw them, without them ever having to come into your office, is a huge increase in the ability to work with that patient. It's really a change in the way the healthcare is being done.
Well, it sounds like the technology is getting there. Now it's just how you implement it.
Well, it's actually in healthcare we talk about more workflow. So there's the physician, the technology's been there, and the technology's there. It's the healthcare, what we call transition of care and care flow, right? So you have to make sure that the patient is engaged, the patient's family is engaged. The technology is in the home, and now that their care plan is all encompassing, right? So everyone that's involved is utilizing the technology.
Well, Nancy, appreciate your enlightening us on this, and look forward to an update next year.
Absolutely. So come watch us. Come listen.
Okay. Well,
Thursday.